Good afternoon. So today I will discuss about deviated nasal septum. Deviated nasal septum is the most common deformity of is the deviated nasal septum. So the septal cartilage, which is the medial wall of the nose, is basically deviated. So this deviation can be C-shaped deviation or S-shaped deviation or deviation with spar. So this deviation basically caused in birth trauma. So during the delivery, if there is a prolonged delivery, then this causes the deviation of the nasal septum. Now, the clinical features of this deviated nasal septum is the nasal obstruction. So, with the deviated nasal septum, if there is a hypertrophy of the turbinate, especially the middle turbinate hypertrophy on the opposite side, causes the nasal obstruction. Second is recurrent sinusitis, because maxillary, ethmoid and frontal sinus all open into the middle meatus. So if there is a hypertrophy of the middle turbinate, then there is a recurrent sinusitis. So acute otitis media, as there is a sinusitis, so there will be a postnasal discharge due to the sinusitis causing the acute otitis media, blockage of the eustachian tube and acute otitis media. Ethmoidal neuralgia or sclerosing neuralgia, sphenoethmoidal neuralgia or anterior ethmoidal nerve syndrome is also due to the contact point headache due to the pressure exerted by the middle turbinate. Third one is the epistaxis. Epistaxis when there is a septal spar. If there is a deviation, septal deviation with the septal spar, then this spar will irritate the mucosa, and as a result of which it causes the epistaxis. Cosmetic problem like crooked nose or deviated nose will be there, and hyposmia, facial pain will also be there. So these are the clinical features of deviated nasal septum. The patient will complain of these symptoms. Now coming to the investigation of choice, so we have to do the nasal valve patency test by Cottle's test. We have to ask the patient to uh, to uh, to elevate his cheek, and when he elevates the cheek, if uh, he can breathe properly or he can inspire properly, then the nasal patency is improved by opening the by opening the valve, nasal valve. So the the there is a obstruction because we manipulate it by doing the Cottle's test. We manipulate the valve by doing the Cottle's test. So that means there is an obstruction. So this is the investigation of the other investigation of choice is X-ray of paranasal sinus and X-ray of face. So these all is the investigation of choice. So management is greater than 70 years age for the surgery. And why this is greater than 17 years? Because secondary center of ossification fuses by 17 years for the facial development. Now what is the surgery? There are two surgeries, submucosal resection surgery and septoplasty. First we have to give injection of 2% xylocaine, that is a local anesthesia with adrenaline. Then in both the SMR as well as septoplasty, but SMR we have to give the Killian's incision, that is 5 millimeter above the caudal border of the septal cartilage. So there is a septal cartilage, the caudal border of the septal cartilage 5 millimeter above we have to give the incision, that is the Killian's incision. Then the flap is raised on the both the side. After that all the cartilages are removed, so it is an extensive procedure. So there is a chance of perforation. So there is a chance of perforation, there is a chance of septal hematoma, septal perforation. So it is less preferred nowadays, submucosal resection. But what is about septoplasty? Here we will give the Frias incision at the mucopericardial junction. We have to give the at the caudal border. You have to give the incision. Now one side of the is open, on one side the flap is opened. Now here the deviated part of the cartilage as well as the bones are removed. So it is a conservative procedure, more preferred, less chance of septal perforation and septal hematoma. So this is all about deviated nasal septum and its management. Now coming to rhinosporidosis. Rhinosporidosis is a granulomatous disease of the nose where granuloma is caused by Rhinosporidum severii. So Rhinosporidum severii is one of the bacteria, one of the protozoa. Sorry, it is a protozoa, aquatic protozoa, Mesomycetozoa family. Mesomycetozoa family. It is basically seen in the southern part of the India like Kerala and Tamil Nadu. So where it is our clinical features, the clinical features is immunocompetent patient like HIV patient or cancer patient, and it history of pond bath. This is very much important because these patients have a history of pond bath, and in the pond the water is contaminated by the cattle dung and gets entered, the sporangia gets entered. Now the cutaneous or subcutaneous nodules are found. Cutaneous nodule is found in genitalia, in the mucous membrane of the nasal cavity or in the oral cavity. And the subcutaneous nodule is found in the leg. So the cutaneous and subcutaneous lesions are found, and it is due to the contaminated nail. The patient's nails are contaminated. So red polypoidal mass is seen in the anterior rhinoscopy in the nasal cavity, which is giving the mulberry appearance with white dots. This is very much important. Mulberry appearance or strawberry appearance with white spot. This is the sporangia. Patient also complains of epistaxis and nasal obstruction. So what is the diagnosis? Nasal smear and biopsy is the diagnosis. We have to take the biopsy from the material. Treatment is wide excision and the cauterization of the base of the sporangia. And now there can be a recurrent chance of rhinosporidosis, so we have to give post-operative dapsone. Dapsone should be given to reduce the chance of recurrence. So this is all about rhinosporidosis. Other granulomatous diseases are also there like sarcoidosis, TB, leprosy. So rhinoscleroma, which is caused by Klebsiella. These are the other granulomatous diseases. So here it is very much important that rhinosporidosis and deviated nasal septum I have told. So thank you.